This is Dr. Chris Doherty here. We're doing an arthroscopic tennis elbow release. You can see my shaver has debrided the capsule. In this case now we can clearly see the tendon for the extensor carpi radialis brevis. This is the tendon that essentially has just gone bad in tennis elbow. Basically what happens is the tendon starts getting micro tears and it doesn't have the ability to heal itself, so over time it starts degenerating and just causing more pain. In an arthroscopic tennis elbow release, we simply resect the torn portion of the tendon. You can see the very top part of the tendon above us, which is the white. We don't want to cut through the muscle, so we simply cut the white tendon that's causing the problem. This is the tendon for the extensor carpi radialis brevis. And once we've got this cut completely, then we'll bring our shaver back in and debride it back to a nice stable margin. Debriding means we just essentially clean it up. Occasionally, patients will have tissue that's in the backside of the elbow, which could be impinging or pinching inside the joint as well. So we'll drop into the backside and inspect for this as well. This is where we'll see what's called a radiocapitellar plica. So here we're just utilizing our shaver, debriding this resected portion of the extensor carpi radialis brevis. And again, this is on the outside or lateral part of the elbow. Once we take this back to a nice stable margin, then we'll move to the backside of the elbow, resect our radiocapitellar plica, and look at the backside of our radial head. Here, to the right of the screen, is the arm bone, the humerus, and at the bottom of the screen is the radial head. So we're going down deep enough to make sure we get all the tendon fibers resected, since this is the source of the pain in this condition. So now that we've got the tendon cleaned up in the front, we'll drop in the back. We'll clean out our radiocapitellar plica. Cartilage is usually nice and white and smooth. Here we see there's a raw spot that's early condymalacea on the backside of the elbow.